Hello and welcome to Joas Medical Diagnostics. Today we will be talking about a very important and enlightening topic, which is PID. Have you watched our previous topics? If you've not, kindly watch them on our Facebook page, on our YouTube page. Today we are going to be talking about PID, basically, which means pelvic inflammatory diseases. I wanted to share this because I have had lots of questions about PID recently. I am sure some of you have had a scan that shows PID when it's not really PID. Sometimes, or we've had diagnosis of PID and I just wondered, okay, what's PID? So, what pelvic inflammatory disease basically means is that you have an infection that has spread around the whole pelvic area. And the pelvic area for the woman is the birth canal, the cervix and uterus, the tubes and the ovaries, and has gone into abdominal cavity. So, that's PID. So, what causes PID? PID is basically caused by infection which are called sexually transmitted infection or sexually transmitted diseases. And these are chlamydia, gonorrhea, and some other bacteria that are just mixed infection, or it could be TB, tuberculosis. And it's important to know that tuberculosis is rampant in our setting. And so, if everything fails in terms of investigation, it's always good to look out for tuberculosis. I want to differentiate between STI and candidiasis because I have had people who say, yes, I have an STI. Okay, I'm like, describe it. And they say, describe something we call yeast infection or candidiasis. It's not the same thing. I want to differentiate the difference between an STI and a yeast infection. Because I've had people who tell me, yes, I have an STI. And when I question, I ask more. They say, yeah, it's a whitish discharge that's cloudy and it keeps coming back. And I'm like, no, that's not an STI. That's a yeast or a candidiasis. It's very common in women. Another differentiation is a UTI, which is the urinary tract infection that also confuses some people. Urinary is in the front where we have the urethra. That's where we urinate from. That's the infection that have ascended into the bladder and is in the bladder, so it's not from the birth canal. So they are very different from an STI or STD. So what are the symptoms that you should be looking out for when you think you have an STI like chlamydia or gonorrhea? One of the most common symptoms is that you have a lot of lower abdominal pain. You have intense pain in your lower abdomen and it's like cramping or sometimes a burning sensation that doesn't go away. It keeps coming and sometimes it becomes worse. Another symptom is heavy PV, which is pro-vaginal discharge. So you have a lot of discharge that could either be colored or not colored, but it's a lot in amount and sometimes it has this unpleasant odor and it's really different from your normal. So when you have these two symptoms, you should think, okay, maybe I have an STI and you should go and see a gynecologist. The other things that you should look out for are either some abnormal bleeding between menstrual cycles, so that could be a sign, or you could have a painful intercourse. But not all painful intercourse is because of PID, but it's an important sign that should tell you, okay, I need to go get the checkup. If it does spread too far, the other symptoms could be that you even get an appendicitis. If the PID or infection spreads to the appendix, then you get the symptom of an appendicitis. So you could have a pain on the right side that is severe. You could get fevers or chills. You could get really sick. This is the stage where it has gone too far and it's important to note that. We also have ectopic pregnancies, where pregnancies in the tubes or in other areas of the body that can be caused by PID or that occurs when you have PID. So that is always something that you should be looking out for. And why am I talking about PID? It's important to know that PID is the most common cause of infertility in your setup because what does it do? It causes your tubes to be blocked, and if your tubes are blocked, then you won't be able to conceive. So it's really important to guard yourself against sexually transmitted infection, which will lead to PID and the other things that you should do that can cause chronic pelvic pain. So if you have the pain that is niggling and is always there in your pelvis and you are wondering, why am I always feeling this pain in my lower abdomen? It's not before my menses or after my menses. It's not a cyclic pain and it's not a certain time that always happens. It's just always there. It could also be PID. So my message today is that, young girls or even people who are looking to conceive, please guard yourself against these infections. And it's quite easy. I preach abstinence, and if you can do that, please do that. And if you can't, please protect yourself. use a condom, use the barrier method, because it's not always about pregnancy. There is HIV and there are all other STIs that could tamper with your future fertility. So please, let's be very, very careful. We have come to the end of today's topic. For further inquiries, please kindly contact us on our WhatsApp number or on our Facebook page. Thank you.